Welcome to Truly Heal and the Truly Heal webinar. I hear from Deborah that we are live and that she's turned us live. And I'm pretty excited today to share with you all of those devices. Lucky they're all sold, they just arrived and we're sending them out tomorrow morning, that we had the opportunity to show them all to you and explain all the differences. So perfect timing. Now, would you mind just telling me very short whether you can hear and the picture is clear and everything works? I hope it is. I can see on my screen over there that we are live, and Deborah tells me, yes. Now, I won't have her talking to me because that's pretty distracting, but she's sending me here on my phone all your questions that I can respond to them, and she's already typing me in, yes, everybody's on. And I will try to get to every single question that we have. And I will also take many of those that I've been repeatedly answering over the past few weeks. Because, you know, PEMF is always seen as a targeted treatment. How do I do it for liver cancer? Is there a difference if I have pancreatic cancer? And it is, on one side, very understandable that you look for a solution to your problem. But it's also, we need to see the overall factor that PEMF allows us to treat. And that's what I would like to cover today. Now, let us start very short with power and intensity, because we have all the devices here. And this is the PMT Digital. Now, all of them are PMT Digital. They just come in different models. When you go to our shop, you will see that they all have an individual button now to buy. This is the PEMF Desktop Digital. This is the PEMF Carry Case Digital. Same device, pretty much same weight. They both have the same internal logistics, everything the same dial button, on and off, the buttons to connect, and a power supply. So all is the same, they just look different. This is a sleek version for an office to have in your office, one location, no movement. This one is ideal if you're traveling, if you go and see clients, you take it with you. A lot of our private clients, and let me just pull Deborah out of my ear, then I can hear myself clear. When we look at this device, this is ideal if you travel a lot, if you take it with you overseas, if you treat yourself and you stay in different locations, if you have grandma and you visit her once a week and you want to give her a treatment. For doctors who are traveling, doctors who do house visits, emergency doctors, osteopaths who have different places that they work with. Very easy, very convenient. You close the suitcase, it's actually waterproof, very easy to handle, and it comes even with a carry case with a bag where you can put in your applicators. Now, there's no difference in device. The scale goes in both of them from 0 to 10, and from 1 to 10, and that regulates the power output. Always the same, and I talk about the power in a moment. So these are the two devices that we use for clinical and for traveling doctor or somebody who takes it with him all the time. Both of them work on 110 and 220 volt. They have an intelligent power supply, so they adjust to whatever needs you have. And then we have here the big horse device. Now, it's identically the same device, it just has two more banks of capacitors, so it's stronger in output, because when you use a horse applicator, and let's just say I would like to use this, I can't go around the horse, so I need to have a cable which is 5 meters long. And if I use that long cable, then I lose power on the way. And that's why we've added here two capacitors and make it stronger. Now, there is only two types of clinics that really want that stronger device with the short cables, and that's mostly when you deal with incontinence, where you need that big pulse into the diaphragm. When you sit on the loop and you pulse up, that's where it really makes sense. Otherwise, it doesn't. See, I come from an area where I really thought more power helps more. And that's me. More pills help more. It's probably how I grew up, how my father was living. So I was jumping onto that bandwagon and I thought, yep, it makes sense. If it helps and more helps more. No. what we've noticed, and this is something that really came through in the past few months. Michael, who is producing PEMF device, PEMF systems, those devices, he puts a lot of effort into sending those devices into clinics for research studies, getting FDA approval and all of that. And what all the doctors have asked is, instead of having a spark that is, strong, where you have those muscle tremors, instead of having that, they want a very narrow spike, just very short, big, a hundredth of a second. So the shorter it is, the more effect it has. And that was a long development. For those of you who remember, we started using these devices 2-3 years ago. And with every time we've changed the spark. And if you have an older device and you would like to have the latest spark programmed into it, let us know. We have an update program so you can get your device upgraded to the latest spark. But all of those doctors agree, if the spark is very narrow and strong, then it has highest results. So what is reduced through that is your muscle spasm. So if I turn on this device and put it on, and actually I take Deborah off, because you remember, electronic devices should not be used with this. So let it turn all the way down to 1. Now I turn on the device. Where is it? The switch down here. Now it lights up. Fan comes up. And now I turn it to 5 minutes. And you can hear the spark. Now this spark is very fast. And if I turn it stronger, even though it has enough grunt, I feel a lot less of that spark than what I felt before. The older devices, you really rattled and it shook the whole body. Those newer devices don't do that anymore because the spark is so short that your muscles don't have the time to respond, to react to it. And that is something that we found out in all of those research studies. And let me just pause that for a moment, because otherwise you hear the tick, tick, tick the whole time. Now, when you get a device, whether it's the DCM or the digital or the carry case or the big horse travel device, with the big wheels or the small wheels, it is identically the same spark. And we can program them. So let's say in a year's time, we found the ideal spark, the sweet spot, which helps with detoxification, with wound healing, with osteoporosis, really in the best way. And believe me, it's a young science, and all of those doctors have different approaches. So until we get to that really sweet spot, we can reprogram them. And I will send updates out once we have the latest spark. Now, all of those devices now have the same spark, except this one has those 2 rows of capacitors, and therefore it's $1,000 more. If you need that, if you do incontinence treatment or you treat horses, then it's worth its money. Otherwise, you don't need to. These devices are so powerful, are so strong already, that they create detox reactions, and help with detoxification so massively that you don't need it. Let me just turn this one on. I turn it on. Okay, power comes on. I turn it all the way down to 1. Always do that. And now I turn it on. And it's identically the same spark. And you can feel, if I bring it up to level 5, that's already causing slight irritation, to my muscles. And it's a strong spark. But it's not harmful. But the effects are amazing. Now, I've been speaking to some of those doctors, and they say, look, Marcus, if a patient runs it on that low level, 1 or 2, for 10 minutes, they have a detox reaction which is more powerful than if they run it on 10. Because it's that detox spark that really clears out the cells in a very fine manner. So don't overdo it, don't hammer yourself. More is not always more, as I always say. But, and that brings us to the second part of this question in regards to strength and distance. And please look at this. If we would say we have this mat now, this loop, and it produces at the moment, let's say on 10, it produces 7,000 Gauss. And again, really important. You will hear values, let me just pause it, that you hear me clearly. When you have a device that is advertised with 35,000 Gauss, 40,000 Gauss, all of those values are calculated mathematical values. They're not real. The device and output and loss in cable and loss in magnetic field, when you measure in here, the device, they come to about 7,000 Gauss, 9,000 Gauss, and the DCM to about 3,000 Gauss. That's really the value that we can measure. Now, I purchased a $5,000 device to measure that intensity, and now because the spark is so short, my device doesn't even catch it. It doesn't even get it anymore. It's a slight difference in measurement now that we need to do to get those values. But 7,000, 3,000, 9,000, that's pretty much it. So if I turn this device now on to level 1 or 2, I will produce something like 100 Gauss, 200 Gauss. That's not a lot more. If I bring it up to level 5, then you will see level 6, then that's about 3,000 Gauss. The higher you go, the more power it needs to create that jolt, but it's not equivalent to the power that you feel. So don't worry about that. This is probably the power on level 4 or 5 that you get from a DCM. And that is more than enough. Now, that's measured exactly. Let me just turn it down before I bring it over my head. Just for safety reasons. You can bring it over your head and you hear it's still ticking, and I can do a head treatment still on level, what is that? 3? And that's still fine. I don't feel anything. But, you know, I've been detoxifying since a long time. On level 4, I feel it here. I feel it in my ears. I feel it especially in my teeth and jaw. So I wouldn't go higher than that. And you don't want to do any kind of uncomfortable treatment, which means if you treat with the DCM, with the smaller one, it's ideal for brain treatment. You don't need to worry. And you can do your shoulder and you can do everything else. And I cover that in a moment too. All right? So let's say we measure the power right here in the middle. This is where the main power will be. Turn it off. That's where I have the 1,000 Gauss. So when I go up, and it's measured by centimeters. So this is within that 1 centimeter, I have still 1,000 Gauss. Then I go up 2 centimeters, and then I have already 250 Gauss. So it reduces by a quarter. You see, 4 parts. Here I have a 1/9 of the intensity, and that's on 3 centimeters. So if I go up to 20 centimeters, you know, even pulling in my tummy, that's a stretch. So I have definitely on this side 2.5 Gauss. So it's not a lot of power that is left on the other side of the body. That's why putting it from both sides makes sense to get the energy in. And that's valued at 1,000 Gauss. So I haven't unpacked them because they are shipped out tomorrow and they're all new. So if you have a MacPad 2, which is the ideal size, you know, for full body half body treatment, for organ treatment, for neck treatment, you can put it behind your shoulders. This is the ideal form. This is 1,000 Gauss on a DCM, and here it goes up to 3,000 Gauss. Now, let's do the calculation, because one of the top questions that we always have is, can I use it with a pacemaker? Can I use it with stents? Can I use it if I had surgery? Look at the distance. Now, for me, from behind, if I have the treatment from behind to where my pacemaker would be, you know, 10 centimeters. So if I have 2.5 Gauss on the pad with my DCM, 1,000 Gauss, and I go up 10 centimeters, 15 centimeters, then I'm already in a safe zone. And you can ask the producer or the doctor what kind of values your pacemaker has, how strong it can be pulsed at, what the magnetic field is that it can endure. So you can find those things out. And we've already had 5 or 6 clients with pacemaker contact their oncologist, contact their doctor, their cardiologist, and contact the doctor. And they got results back that are so high that even on full power, nothing happens. But that's the newer devices. So you need to check with your doctor to see whether that's relevant. Not everybody. If you have stents, I would stay away at least 10 to 20 centimeters from your heart. So you don't want to pulse here, bang, bang, on full throttle, which is anyway too strong or not relevant. But you can still do your tummy. You know, that's still far away, and it won't have an influence and an effect on those stents or on the pacemaker. So treating your tummy, treating your kidneys from behind is fine. To sit on it, do your hips, you know, put your foot into the loop. Do it even, you know, if you do a treatment like this for your shoulder blades, which would be fine, just stay about 10 to 15 centimeters away from the loop and you should be fine. Now, I'm not saying that as a legal advice. I just say that if you keep it toned down and you don't run it on full power, those big devices, there should be no problem. But you can always speak with your doctor and ask for the rating of your device, how strong it is and how much effect or influence it has, all right? Very important. The small device like the Curotron or the DCM, if you use it on the pad, you don't really need to worry. There is no breaking of blood vessels, or there is no breaking of a pacemaker, because with the pad it's really convenient, it's very easy, and the pulse won't be so strong that on a distance of 10 centimeters you don't have that danger anymore. All right? I hope that's clarified. Deborah, do we have any questions in regards to this? Now, she doesn't hear me anymore. Anyway, I don't hear her. Let me just plug this in. Okay, what are the different strengths of the PEMF? I said 7,000, our measurements. And again, 2 different devices, and we had 6,000 to 8,000. So don't really go too much on that. On 10, you really use it pretty rarely. It's very powerful, and it would only be used over your belly, you know, to pulse into the immune system and for detox. And when you sit on it, where you really get that charge into the diaphragm, into the colon and prostate, that's where those devices really are powerful. This one here, as I said, is identical. It's easy to carry around and to take with you if you are in a clinic and you use it from one room to another, but it's mostly designed for horses. And if you want that extra kick, it's a little bit more expensive, but it gives you that extra power. The DCM 3000 Gauss on the loop, on the small butterfly, double loop, like this one here. And if you go for the big loop, it goes already down to 1000 Gauss. And on the back pad, it's 1000 Gauss. And if you turn it onto the oscillating, it's about 800 Gauss. So don't worry, they are all strong enough to achieve the results. They do it a bit faster. The DCM takes a little bit longer, and the XBSE, the oscillating device, takes a little bit longer too. But they all come in the end effect to the same results. Are there any dangers in using PEMF machines? I'll have a few slides on that, and I'll talk about that in a moment. The dangers are really only in the beginning, when you start out, when you overdo it. I am, again, prime example. When I got the device, I turn it on, I have it sitting beside me on the office, and then I bang, bang, bang. Every 10 minutes, I do 5 minutes. And, oh, I don't know, I have headaches today, and I feel slightly dizzy, and I don't know, it's somehow strange. I'm not up to it. Oh, wonder why. See, every single time you do a treatment with PEMF, you flush out more toxins. And believe me, there are plenty more. We are hogs for toxicity, so it's not that you do the treatment once and then it's all gone. It's actually an ongoing process. So don't think when you do one treatment that that's it. It will be happening. I do it now since 5 years. And if I overdo it and I overdo too much, or I do it in a position that I haven't done before, I flush out more toxins. Your body is soaked, organs, bones, lead in the bones, in deep tissue. So when you start losing weight, for example, then you will detoxify massive amounts, and that's all flushed out. So always keep doing it, but be careful that you don't go into that Herxheimer reaction. You want to avoid that. Rather do it more regular so that you feel fine, that you feel strong, that you feel energized, and not go to that point where you go like, oh, I stopped working for today because I can't concentrate anymore. All those toxins are flooding the body, and I told you, detoxify, chelators, binders, all of that, but we'll cover that as well. I think we've covered the strength. I just wanted to see, can I overuse the machine? All the same, you can't. You reach a point of saturation where your cells are all charged and are working fine. If you keep doing, it probably is a bit of a counter effect. Like if I do it too long, too much, then I will get more tired. So don't you feel that. What I always say, people want, 8 times per week, exactly 15 minutes. For me, that's fine. For you, that might be an overkill. So don't listen to what people tell you to do. Feel it. Do I feel better? In the beginning, you will probably get very fast to that Herxheimer reaction. Just doing a treatment like this, we had people during the workshop just putting it around, turning it on a low level. Let me just go back. And they were just pulsing some. Okay, got the wrong loop. I just thought something's wrong. So, okay. Doing it like that, they did it, and then they got white and they got sick. And if you use a lot of medication, if you have lots of toxins in your body, heavy metals from your teeth, mercury flushed in, if you have lots of lead or aluminium, for example, deodorant for years used deodorant with aluminium and it's soaked up into your body, and you have those levels, then starting to do a treatment like that will flush out toxins a lot more. So you might need one treatment every second or third day, a short one, and then once you've done it for a while and the toxins are flushed out, all of a sudden you can increase and you get more and more energy. So don't listen and don't think someone knows what you should do. Feel it. I always say disease has something to do, or getting to know yourself is one of the factors. Becoming conscious of your body is one of the main healing factors. Oh, I ate last night such a mountain of sauerkraut and I feel crappy today. Consciousness. You become aware on how that affects your body. In the same way, are treatments something that you feel how they affect? And PEMF is so powerful that it can cause dilemma. You remember we had a workshop and we had all those devices available for clients, and some of them overdid. They did too much and too many treatments, and they got so terribly sick that they had to be hospitalized. One client in particular. And then the oncologist fired against us and said we provide dangerous treatments to clients, and almost closed us down. So don't do that. Gentle, start a little bit, see how you feel, improve a little bit. Sometimes it's, it really is cool. You do a treatment and you do it all around your body and it's fine. And then you start doing your teeth and your jaw, and you get massive headaches because you released a pocket of toxins there. Or from your neck, a lot of people have neck problems and they start using the butterfly in that area, and they've just released, like you put it like this over your shoulder and you pulse into that area, and then all of a sudden they feel like they get dizzy, pocket of toxins. You know what your body does? Stores everything toxic into one place and encapsulates it into fatty tissue. That's how your body deals with excess toxins. Oh, and then that's where the tumor starts growing, where the cells get sick, where they mutate. And then we wonder why toxins have so many more, tumors have so many more toxins than healthy tissue. It's because your body stores toxins and packs them away. And that's what you release when you use that. So it's good that you release it. It's fine, and we're happy about it, but gentle and slow, all right? And with distance, you realize if I hold it here and I have a treatment 20 centimeters, in between, I have, instead of 1,000 Gauss, only 2.5 Gauss. That's fine. If I want to treat my teeth, I don't want to smash them. I want to go in a bit of a distance. So what you can do is, I don't have one here, but you can take a pillow and put that in between so that you have always the same distance, and start out gentle on level 1. Next day, go up to level 2 and bring it gently up. Don't stretch, right? Got it. I hope you got it. And I'm checking in a moment whether we have more questions in regards to that. Okay, let's continue. Ringer, oscillator. I just want to compare that very short again. Ringer is every bang that you have. Bing, 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 and you can hear it when we turn it on. Press the right button. With every pulse is like a little club that hits all cells. So there is no reason to think about that some of your cells don't get the energy. All cells will get the energy. Those who are closest get full power. Those who go a bit further away get less power. But like we see on a tri-field meter, we can measure that still 5 meters away. So like I said, energizing the body will always happen, and therefore ringer devices are very fast, very effective. Now we look at oscillating devices. Now, every cell in your body has a different frequency. My eye cells have a high frequency. My tongue has a lower frequency. My skin has a very slow frequency. My bones have the slowest frequency. So every cell in your body has a different frequency. Now, if you buy a Curotron, an oscillating device, then that will start singing in a frequency, like bzzz, very high. And then all the cells in your body that are in that high frequency, especially if you use the coil, the small coil, let's say in your brain, or head, all the cells that sing along in that high frequency will start to respond. Two tuning forks that are at the same frequency. So that one sings and that one sings along. Now, if you keep your cushion here, the device will switch over after about 3 minutes to the next frequency. And then it will do, and then all the cells who also are resonating with, they start swing up. And that's why it's important when you do a treatment with the XBZ or with the Curotron device, any oscillating device, that you have the treatment on that body part, wherever you want to treat, for the whole period of time. Because in that half-hour or 20-minute program, it will go from very high frequencies to very low frequencies through, always in 3-minute intervals, and will vibrate the different cells. And that is important that you do that consistently over one area for that treatment. And that will give you then the same results. Whether they sing along or whether they are bang, the sound is always a singing of a bell. So that's fine. It just takes longer. You will need to do, with the Curotron or with all oscillating devices, more treatments to cover the whole body and to energize the body. Whereas with these devices, with those ringer devices, you will have all cells at once. So a 5-minute to 10-minute treatment can compensate easily a half-hour treatment in that field. And that's why it's mostly used for clinics and for people who want faster results. Okay? Is that clear? All right, now let me go to best practice. Really important. If you provide this treatment to others, you need to be very cautious. And, I speak out of very, very good experience. You have no clue how scared I was when that lawsuit was filed in America. Because, first of all, Americans, they sue everybody, and they have such strange figures, with so many zeros behind that you get really scared. for something that you want to do good with. I had the intention to showcase those devices and let people try. I didn't even have in mind that I wanted to provide treatment, but if it's twisted around, you can get into serious trouble. So if you have, put a waiver up, a waiver, and let them write and sign. It's on their own risk. You have given them the warning that if they have a pacemaker, if they have stents, that you don't guarantee any or warrant for any risks. It's on their own risk, and they have to stay away from high frequencies, high power. Don't go above 5, 6, 7 and then put it on your critical areas. Keep it on an eye on them, that they don't overdo it. People seem to forget that they have those problems. Also be careful that they don't have a strong Herxheimer reaction. See, a lot of clinics, they provide the first treatment for free, and they do half a treatment, 10 minutes, to show how it works. On all trade shows, you know, one treatment, 10 minutes, so that the people feel, but that's it. So they have a great result, they have great feeling, and then they buy the device and they can stage it on their own. If you provide straight out a massive treatment, which we had done, because I didn't control it, everybody could just do what they wanted, and we had that feedback. So be careful. Weaver, it's not something that will change your life overnight. You know, I like this picture here. You know, they expect, I have this device now since 2 days, and I've treated my shoulder 5 times, and I still have shoulder problems. You know, it's kind of a farce what we expect. Medicine doesn't get it away at all. They have no treatment, but now all of a sudden we have a miracle. It's a joke. If you have damaged tissue and had problems for 50 to 80 years, and then you can't expect miracles. It takes time for your body to rejuvenate. It takes time for it to heal. It takes time to take down the toxins. Like I said, I'm doing it now since 5 years, and I still have discharge. I was in my mercury levels off chart, you know, 4 times off chart. When you have the 100% level on the end of the red, I was 400%. So I brought it back into the yellow, which is about 200%, 200 level. So it took a long time, about 2 years to bring it down. And even now, I still have toxins flushing out. So don't think this is a process that goes overnight. It requires a bit of dedication and repetition. And this is why if you have a device like that, I always say take it into an area where you spend time. I unfortunately spend way too much time in my office. So it's a bit of a critical thing that I have it right beside my desk. Other people have it in front of their TV. So in the evening when they sit down, they have an hour watch time or an hour and a half or 2 hours for a movie. Then the first person has a round of treatments, 20 minutes, 30 minutes. Then the second person, the husband, and everybody treats their areas of concern. We talk about that too, how you treat certain things. But don't overdo it, stretch it out, do it repeatedly, drink a lot of water with it. Water is the solution to pollution, right? We flush out toxins, so drink plenty and prime your body with binders, and we'll talk about that as well. And then be careful, slowly increase the power. Careful about, you know, doing this and turning it on would be deadly for my phone. It would kill it in no time, especially close by. Now having it here, you know, my phone, and turning this device on, where do we? It's this one here. You know, and pulsing even on the strongest level, 20 centimeters, 2,500 Gauss. So now, probably we have it on the strongest, this is 9,000. So if we take that down, the chart is not here anymore, but that's still, my phone, yes, it still works, all good. Distance makes a huge difference, whereas if you bring it close to the body, now, wow, I feel it. It is a strong pulse. A bit further away, it's already a lot less. So really notice in the vicinity, it's not a problem. So don't be scared too much. A lot of people have asked if I have in my room a computer, is that dangerous? No, it's not. If you hold it directly over your computer, then it is. Then it will fry the electronics. but just 20 centimeters away, like they write in the instructions, 20 centimeters away, 1 foot away, and it's fine, no problem. Okay? Hearing aids, very important. We have people, they forget that they have hearing aids. And have you seen those tiny little things that they have today? They're inside the ear, you don't even see them anymore. And then they're wirelessly connected to their phone. Those fine electronics are very sensitive, and going here and saying, okay, now we have a head treatment, right over your ear, or we treat your teeth and you go around and you come too close to your ear, they're dead. Credit cards, very sensitive. If you have the old tapes, music tapes, videotapes, just close by, even 10 centimeters, 20 centimeters away, they are dead. So be careful. That's just something you don't want to do. So credit cards, put a little basket up. So if somebody comes in, put the basket up and have it away. Credit cards, I can show you if you want, but this is not really the main thing that we want to show. It's such high voltage and such low amperage that it doesn't cause harm to the body. And that's why don't worry about those things. Stents have sometimes a metal mesh. So if there is a metal mesh, that can respond to those vibrations, and then through that vibration smash the scar tissue. And that's only if it's really young or freshly. If it's grown in, if it's properly healed, there's not that much of a problem. And also talk to your doctor. Most of them are in a very fine fiber mesh today that doesn't respond to magnetic fields. Okay, and then stents and pacemakers. I think that's pretty much it. And if a client has on jewelry, if they sit here and they have a necklace around, which is gold, then all of a sudden they have a big spark. I had a young lady, she had a nose ring, and all of a sudden she looked down and there was a spark going between the loop and her nose, and that was pretty scary. So you don't want to have that. And she just looked and almost freaked out, was sitting paralyzed. So we turned it down, I showed it to her, and she was fine, but you don't want to scare people, all right? Now, I don't go into all the different treatments. I would like to focus on one. See, as a pain treatment, we know it works. It works phenomenal. It's not like a painkiller where you have that dullness. It's more like so much relief and oxygenation and muscle relax, and the frequency that you get into, that pulse that you get into, releases the pain nerves, and it really helps. Not for all pains. Nerve pains, and I just wanted to say that, like toothache, doesn't really have an influence. But you can take a pill if you have real toothache and the nerve is infected. Not even your injections help. No PEMF helps. No medication helps. That's something really difficult. I have heard from some patients who use it, who have bone cancer, and they have great results. They sleep a lot better before they go to sleep, and the pain is really fading after the treatment. So if that works, fine, but it's not for every pain. It's not guaranteed that it works for everybody. But, and this is something I really want to focus on, is detoxification. I've just watched a video, and you've seen my mercury video, hopefully. If not, I'll put a link underneath. Deborah, would you please put out the link for everybody about the detox video and heavy metal mercury poisoning for detox with heavy metals. Incredible. When you see a sheep and they put in mercury, in 2 days, it was all mouth and brain. After 4 days, it had the kidneys. After 6 days, it had the whole intestine. After 28 days, the whole intestine, the throat, the kidneys, the liver, everything was pitch black from that radio-labeled mercury. So don't think you're not completely poisoned from head till toe, including your organs, from mercury fillings. And if that's something your mum already had, it's all passed on to the child. So it's not that the children don't have that issue. Where was I? So detox is probably the main factor where we see the biggest response. Dr. Gary Gordon did a long test where they had patients going through chelation therapy, oral chelation programs and chelation programs with IV, DMPS and EDTA. And they did with PEMF a group and without PEMF a group. And the PEMF group had double to triple the detox. So really it shakes loose all those toxins, and that's why we're so excited. When you see this was a client that we tested before, and then we went with simple clay, modified citrus pectin, chlorella, zeolite, like the standard binders, and just did for a whole month regular treatment with PEMF twice a day, morning and evening, and we added all those binders and look at the results before and after. It came from 100% down to 75%, and all levels, you can see it's not just some, it's all levels went down. And that is really the main factor. Your membrane of a cell has so many iron, potassium, nutrient channels, glucose channels, all the waste channels, and all of those channels, they clog up with toxins. And you can see mercury occupies the same channels as iodine and zinc and selenium would use to get into the cell. So if you have lots of mercury pollution, then they will block those cells. Some of them will go into the cell, which is really bad because that mutates the cell, kills the cell, causes cancerous cells, really damaging. When it's still dogged on at the outside and has not entered the cell, this is the critical phase. And then you have the mercury floating in the plasma outside, which is really the dangerous part because they are negatively charged. So they will always dog on to those membrane receptors. And that's what you shake loose when you do a treatment. So when we do PEMF treatment, and I don't have that pulsing chart, I really love that, but we'll find it somewhere later, probably. So when you pulse your magnetic field into that, and those mercury particles or lead particles or arsenic particles are shaken loose, and you have then binders who grab hold of them and then eliminate through the stool, eliminate through the kidneys out of your body, or you sweat them out, then you have won 80% of the battle. Dr. Mutter from Germany, who is a real beautiful scientist, he treats mostly all brain degenerative diseases, ALS, autism, Parkinson's, all of that. And he really is a mega researcher. And he said, the biggest problem that we have is that one of those toxins is very dangerous. So if you have mercury, for example, but most people don't have just mercury. Look here, the cadmium very high, silver very high, aluminium very high. Now that's 3, 4. And he said, if you put a cat into a porcelain shop overnight, maybe throws over one vase or one cup, but generally cats are very careful. You put a dog into a porcelain shop overnight, they probably sleep, they don't cause a lot of trouble. If they wag the tail, if they hear somebody, they might throw over something, but not a lot of damage either. If you put a cat and a dog into the same shop, you'll have a devastation. 600 times more toxic if you combine just mercury and aluminium, mercury and lead. 600 times to 1,000 times more toxic. If you combine different chemicals with heavy metals, it becomes astronomical. They've combined mold with heavy metal, and it couldn't even be measured anymore. So be very careful. We all have mold exposure. We all have bacterial and viral infections. We all have heavy metals. There's a video on YouTube. I actually should show the link. Deborah, again, sent the link to that video with our heavy metal comparison. I've taken 50 people at a workshop and I tested everyone, and then I just cut out that result, this same picture, and made a movie, and it just goes from one person to another. And you see, there's no one that has no toxins, not one person. So that plus viral, plus bacterial, plus mold exposure, and then you have a toxic cocktail which makes us all sick. So detoxification is key. And this is where those machines really do a dream job in pulsing those toxins out. And then you grab hold of them with these binders. Have a look. Very simple. First of all, pulling out through the skin relieves your liver from a very heavy task. The liver needs to be broken down, the toxins need to be broken down in the liver with detox phase 1, and then detox phase 2. And then there is the elimination through the bile duct. And then it goes through your kilometers of small intestine where it's reabsorbed. Oh, great. And then it goes into the colon where it's reabsorbed again. So very little toxins are released. And that's why liver detox is a slow motion process. That's why Gerson does 5 coffee enemas a day to flush out the toxins, flush them from the colon, flush them from the liver, and keep doing that for a 3-week period to really get rid of them. It's a massive job, does the work, it's really effective, but it's hard work. So if you pull them through the skin, you bypass the liver. If you take them through the kidneys, again, it's a massive job to break down, filter all those toxins out, and then they end up in the bladder. With males, they go through the prostate where the seminal channel connects, and then they start building up more and more toxins in the prostate, which then leads to prostate cancer. Skin is really great. Get rid of it through the skin and don't worry about the whole process. Do a PEMF session, go through your whole body and really do it. You know, like first you sit on the device and you sit on it, and I'll make a photo series to show you the different processes. You sit on the device, and this is where you can really pulse strongest setting. Then you go and put it in the back over your kidneys and adrenals, and you pulse 3 minutes there. Then you take it around and put it over your head, shoulder. This way you detoxify your thyroid, your tonsils, the whole mouth area, your whole teeth area, because this is really close by. If you don't like the jolt, just lift it up. If it doesn't touch, the muscle jolts our way. If it touches, because it really influences your neck muscles, which is the main thing, you have that pulse. So if you lift it up, no problem. If you feel heart problems, palpitations, lift it off, nothing. I can show you. Turn it on, bring it up. Now you can see if it lays on, I have those muscle tremors. And now if I lift it off, gone. Just that little bit takes it completely away. Now if I bring that a little bit higher, I have more treatment for my teeth and less reaction. But you realize I have now this strongest device on the strongest pulse. And it is not as extreme anymore as we had the old devices, which really kicked because the pulse is so short that my muscles don't really have the time to react to it. Okay, but that's too strong. Wow. All right, so this is how you can alleviate that muscle jolt. Then you move to your belly. And by the way, for pacemakers, that's no good. You don't want to do that. You know, you may be here on a low setting with the DCM is fine. It's still 20 centimeters, but otherwise just jump straight to your belly. Again, here you can do full power and treat the belly. This is where your immune system, your gut, your mucous membrane, all the toxins, everything sits in here. So get rid of that, and you can do here 2 or 3 sessions, really doesn't matter. The more you energize your gut, the better it is. It's very good for leaky gut too. So that's the rotation. And then after all the toxins are shaken loose, go into a sauna and sweat out the toxins, or prime your body beforehand. Or you can go into a clay bath as well. You can do a far infrared standard sauna, corner sauna, room sauna. It really takes out all the toxins. Do a mud or clay massage, and then prime your body with binders. Clay, edible clay, zeolite, and then chlorella, modified citrus pectin, really good. Activated charcoal. And again, on our page, you will find plenty of information on all the additional things that you want to add. to bind the toxins. And think of it. Hey, mercury is such a tiny little particle. So it floats in space. It's shaken free from your cell and it floats in space. What do you want to do? You want to encapsulate it, and then it is taken out into your detox pathways. And that encapsulation is done with those binders. And that's why they are really crucial. Prime your body, before you start using PEMF, take chlorella, take zeolite, take some of those and just vary. You know, don't one all the time. Do 2 or 3 and vary a little bit. Take this more, take this less, have a break of that one. You know, I always say we don't catch all flies with one, glue strip. We have several in different corners and therefore we absorb them all after a time. All right, oxygenation, another really crucial point. You've seen my videos, you've seen videos in the clinic, and I don't want to do it again because, it's been used and used and used. It's a fact that when you do PEMF and you do treatments of the blood before and after, you have stunning results. A lot of people ask, are those digital devices the same as the old PMT 120 or PMT 100? Even more so. It is fascinating when you see how far we've come with electronics. In the beginning, it was not. When I got my first digital device, I tested and I sent it back and said, I'll wait until you get there. And then half a year later, they sent me the next device and it started to get better. These devices are phenomenal. You see transformation in the blood straight away. And because they are so fine in their spark, they have even an influence on pathogens. They really destroy and flag pathogens as a cell that shouldn't be in your body. Also cancer, floating cancer stem cells, tumor cells. If you use the paddle, which you can order as an extra, which is, like this whole thing here, concentrated into a little loop here in the middle, it is a very, very sharp spike. And if you use that, you hold it like that and you pulse, it is very piercing. Now that is something you can use over, not over your heart, not over your pacemaker, but you can use on a lower level directly over your gum and treatment problems that you have in your teeth. You can use it directly over your bone cancer. If you have a certain area where this is where my bone cancer is, you can move it here up and down. So it's usually used only in clinics who really can see what they do and how it affects, but it is certainly a valuable tool for people who want that piercing penetration in one particular area. And this leads me to something I always need to say again and again and again, and I know I'm persistent with it. You cannot kill cancer. You got it? You can kill individual cancer cells, great, but you cannot get rid of cancer, not with PEMF, not with chemotherapy, not with any treatment. No GCMF, no nothing will kill cancer. It will kill cancer cells, but they replicate and multiply and come back with vengeance in any form, however you treat it, if you do not change the environment. I use only one example this time. I know I'm usually pretty dense with that. You have mushrooms and you pull out a mushroom and you don't change any environment. Will there be more mushrooms growing? Yes, because it's a network underneath and the soil is fertile for mushrooms. There's thousands of seeds already there. So by pulling out mushrooms, by killing individual cancer cells, I do not change my outcome. I may reduce a few and then they grow back. What you need to do is change the environment. Take toxins out, we spoke about that. Detoxification is a massive part of healing cancer. The second part is oxygenation. Your immune cells, they sit around like that and don't do a single thing if they don't have oxygen. They can't. They need 100 times more oxygen just to kill a bacteria. If they have to kill cancer cells, They need excess oxygen in your system, freely available, freely given by the red blood cells. And they need so much of it to deal with it. And that's why when you have excess oxygen in your system, your healing and your environment will change. Your immune system takes care of the cancer. Your cancer cells don't need to replicate. They don't need to grow and ferment more glucose. They don't need the acidic environment. They start to slow down growth. Oxygen is one of the key treatments in cancer, and you can't deny that. It's the same for any infectious disease, chronic infectious disease. It's really crucial. So when you start doing this treatment, what do you have? From here, clotted red blood cells, small white blood cells, a 5-minute treatment with the Ringer device, bang, everything is fully charged. Those membranes that we had before, those membranes, all the clogging, all the channels are cleared out, all the little gunk has flown away, and the cell can take up nutrients, can take up oxygen, can really breathe again, and it starts to build up with all those negative ions, like walking along the beach after a big storm and big waves and that spray in the air, recharges. You know, Dr. Rao calls this an ion shooter. It's a funny word, but it's true. They shoot out millions of little ions, charged ion particles, into the body and energizes the cell. And that's why they are so effective in giving you that excess energy, allowing your body to breathe, allowing your body to take up all the oxygen and the nutrients. You know, you see here, fully charged cell. And you know, a lot of people don't know, zinc is used in about 60 different body functions. Selenium is used. Magnesium has 70 functions. Iodine is used over 400 different functions in the body. Oxygen, how many do you think? Only one. Only one function. Energy production in the cell. To create ATP, you need oxygen. Now, what is the difference between a healthy cell and a cancer cell? A cancer cell doesn't need oxygen. It ferments glucose. No oxygen needed. Fermentation. Close off. You don't need oxygen. It's a brewing process. Whereas a healthy cell needs oxygen to breathe, to provide energy to the body and to work. So the more oxygen we get to all cells, the more powerful your life will be. And this is why stimulating, clearing out the gunk, allowing those cells to breathe, bringing enough oxygen into the system, when you use ozone, you have your bottle. When you have your bottle, get those little nasal clips, you know, that you put around your ears and into the nose, and get them from eBay, $5 or $2 for a set that you can have. And then put your bottle beside you, breathe oxygen while you do the PEMF treatment. Oxygen and energizing at the same time, you have tremendous results. Always go back to the basics. Don't think you need to complicate and kill. You need to detoxify, energize, oxygenate, and then the healing will happen. All right? So we've got that one. And for those of you who haven't seen this video, this was really true. It was like the first time I brought the device with me to the clinic. They haven't seen it yet. And they've done PEMF treatment with little oscillating devices, and they've seen before and after effects after a week. You know, oscillating devices take time. And then we had this treatment, and Phyllis came from England. She was completely exhausted. She was really rattled, plane flight. She wasn't well. She has cancer. So there was a lot in disorder. And we looked at her blood, and it was really bad. And then she did the treatment. You see it on the video. Dr. Saupe made it really nice and big. And she had the treatment, and after 20 minutes, we tested again. And he was like, oh my God, oh my God. And you could see her too. It was really phenomenal. So the transformation is so dramatic. And that brings me to something else. We did the treatment there, and then we observed how long the treatment would last. In a sick patient who is not well, who has a lot of cofactors, infections, toxicity, inflammation, high acidity. The effects of PEMF were gone the next day. They really deteriorated fast and the blood went back to a bad stage, to this state. Whereas a healthy person had about 4 days. So if you think, how long can I last without PEMF if I go to have a treatment with a doctor? Let me just turn this off. Then we have no sound. Oh, down here. All right. So if you go to a doctor and you have treatment there, depending on your condition, you might want to go 2 times or 3 times a week, minimum, to get the results. If you are fit and healthy and you go 2 times, that's cool. It just gives you that energy. A lot of fitness clubs, sports studios, you know, like bodybuilding training studios and all of those, they use that and they repair muscle tissue, tendon problems, you know, strain from overlifting. They treat that. Soccer clubs, more and more. No racehorse has ever won a derby without being treated with PEMF. They use this device here with the big rollers that they can take anywhere. This is phenomenal when you see how fast you can expedite the healing process just by giving that energy to the body to clear out the gunk and to oxygenate. All right? There is something else. Do we have, how long have we gone? Deborah, are you still with me? First of all, let me just ask, are you all with me still? Everything okay? And do you still hear me? I'm here, lost in my little space. And where is her messages? Oh, shit, we have a lot of questions. I forgot to check that. Deborah, can you still hear me? Yeah? Okay. All right. I should focus on some questions. Would you like to know a few things that just write them now? Then I focus on them and then we'll move on to the next section. Can I use PEMF while having a pacemaker? We've talked about that. Is it safe for pregnancy? Whoa, an important question. Last time, Jerry was with me on the webinar and he said, oh, it creates very intelligent and very soft children. Da-da. If you have high toxic levels and you flush them out while having a baby in your body, what will happen? The baby gets a mega dose of toxins. And I spoke with some of the doctors after our last webinar, and don't do that. You can do it before, as a preparation, before you get pregnant. Get rid of the toxins, get rid of all your slack and slush and the stuck, you know, we call it emulsified muscles, you know, the fat tissue, all stiff and hard. Treat that with PEMF, get rid of that and get lymph activated with it. All great. And cleanse and do and prepare for half a year to a year. And then have a baby, fine. During the treatment, I would not recommend it because that factor, that toxins are flushed out and then are circulating in the bloodstream into the baby, is detrimental. You remember the environmental health group wrote that babies are born with 278 toxins on average, endocrine disruptors, carcinogens, toxins that cause infertility, that cause degeneration, that cause organ failure, mutagens that cause destruction of genes. So you don't want to flush more into a baby. Prepare prior. See, my daughter has this treatment every evening. She's not ready for babies, but she says, look, if I start early, I have to get rid of all my toxins. And then when I get there, it doesn't happen overnight. I can't be surprised. So do that as a pregnancy preparation, but not while you're pregnant. Can children or babies use it? They say, and I'm not saying that I tell you to do that, when children use it, they respond 10 times faster than adults. So if you use the ringer device, use it for children on level 1, lowest level, and do it very short. Just have it a little bit let them sit on it or put it on their belly and pulse a little bit. They are toxic. They are just as toxic as adults are. Some of them, depending on the parents, really toxic. So it's good for them to do. But again, what do you want to do first? Just pulse it free and then have it get stuck to another cell? Prime them with binders. Put a lot of binders into their food as you feed them, lots of fiber-rich diet, all of that. And then introduce PEMF once a week and then twice a week and gently build up on very low levels. You don't need to pulse them very hard, and that will then be very good. Children, babies, I don't see any negative. It actually intensifies bone growth. It strengthens them, so that's really cool. But be very, very gentle with children. Do I need to drink lots of water while doing the treatment? Yes. Water is the solution of pollution. You want to flush out as many toxins as you can. Now, Deborah fell down. I say to my headset, Deborah, because she's supposed to speak to me, but she isn't. She's probably answering all your emails and all your questions. So, when you do drink prior to the treatment, during the treatment, after the treatment, then all those sluggish cells that are now activated, that are now breathing, can take in the water. Very good for the brain. If you do a brain treatment and you would pulse around your brain, you want to drink water beforehand because you know it's taken directly through portal vein or whatever into the brain, and it's then straight away absorbed. And I don't know, I need to look it up, I don't remember, but it's the first thing that needs to be taken out of your body to recycle and to recirculate the fluid in which your brain swims. So if you do a treatment, prime that beforehand. Drink alkaline water. This is where alkaline water is really helpful. Drink that because it's absorbed very fast into the body. And then when you do your treatment, don't overdo it. Again, build up slowly, gently, increase until those toxins are released. In that baby stage, when we are babies, from the moment of conception, I think till a very late stage of 5 or 6, there is the blood-brain barrier is not closed. So toxins accumulate in children mostly in the brain. So when you see children and you go into children's hospital with tumors, with cancer for children, they're mostly behind their eye, in the ears, they have in the brain, it's fat tissue. Toxins are stored in the fat. And during that time when all the toxins can still circulate into the brain, this is where it's really critical. So don't do anything too heavy. Let it flush out. Focus more on binding and getting rid of it than releasing too much at once. The more gentle you do it, there is beautiful homeopathics, hail products that help with binding and detoxification. So use them gently and speak with a practitioner, naturopath, or somebody who focuses on dealing with children. Because the more gentle you do it, the earlier you start, the better their life will be. That was a long answer for should I drink water? Yes, would have done too. What other treatments alongside PEMF are useful? I said a very good one is hypothermia or sauna. If you sweat out and bypass the liver, you really get rid of all of those toxins that you flushed out a lot faster. You know, far infrared sauna penetrates through the skin and vibrates all the cells in your bloodstream. The blood heats up. Through that, it heats up the whole system because it circulates through your body. Increased blood temperature brings you to sweat from the inside out. And this is where all those toxins are then released. Your pulse goes up, your oxygenation goes up, your energy levels goes up, and then it's sweated out from the inside out, from the fine capillaries out through the skin. And this is what really releases huge amounts of toxins, and they don't need to be broken down by the liver. So it's a very, very beneficial way of doing it. What else? I said before, ozone. If you have plenty of oxygen available in your system by drinking ozone water, freshly made ozone water, and by combining rectal ozone insufflations and then have PMF, your body can absorb all of that oxygen and supply your immune system and your body with oxygen to create ATP and to function. An ideal combination, especially for rectal, colon, ovarian, all the endometrial cancer. It's a real must. Those two combined will give you a lot better response and a better reaction. What other treatments alongside? Could you please explain the difference in Gauss? I think we've covered that. I don't go back to that. Just watch the replay if you have missed it. What conditions is it useful for? Okay, we spoke. Okay, I'll cover that in a moment. Let's not forget this. I've understood correctly is immune boosting. Could you explain how that works? Okay. Your immune system is very responsive to environment. It is very reactive to the environment it is in. I've done, when I had my dark field microscope in the beginning, I pricked myself and then I checked my blood. And then I drank a cup of coffee and another cup of coffee and another, until I had 4 or 5 cups of coffee. I could already feel the jitters, and I always checked my blood in those different stages. And with increasing acidity, my white blood cells were shriveling up, were getting smaller, and stopped moving. They were not moving through my petri dish, through my little glass. They were sitting still. So with increased acidity, you stop that. With increased toxicity, you stop that. If you have a lack of oxygen, you stop them. They don't move. So if you give a lot of oxygen into your system, which happens with PMF, because you energize your cells, they can breathe in, they can take up oxygen, they're recharged, round cells, round blood cells, your red blood cells, the hemoglobin can attach. If you do it around your neck like this, and you have here treatment, and you breathe in oxygen, all of it is absorbed and taken onto the hemoglobin and then travels throughout the body. So this is really great. Even if you hold it like that, let's say you have a pacemaker and you hold it like that you treat your upper chest, your upper lungs, or you put it here behind your shoulders like that and you have it from behind, you will absorb a lot more oxygen. Even sitting on it will increase your oxygen uptake because you activate the blood. So that's vast change. Also, the sluggishness of your blood is instantly released. You see that the fibrin from before to after, there is here those fibrin, which is liver problems, and it indicates inflammation, clears up, and your blood is more fluid. That all happens with PMF straight away. So that is all immune stimulating. Your immune system can work. Now, if you have ATP production high in all of your cells, then that provides more energy for your immune system as well to work. So there is a multi-factor approach that you will realize always works. I'm jumping back and forth. What was that? Nutrient uptake. A lot of people say it has nothing to do with nutrient uptake, but that's not true. They start now in almost all clinics that we've been working with to use PMF before they give an IV. I come back to that same picture over and over again. Should make that big. Think about, you put into such sluggish blood an IV vitamin C, glutathione, all sorts of vitamins, and it's floating in there, but it's not really absorbed. It's not carried into the tissue. It's not absorbed into your other cell, because if your blood cells look like that, all your other cells look like that as well. It's like the whole body is sluggish, lacking energy. Now you pulse your energy into the body, you clear all the membrane potentials, your cells blow up, they take on energy, and that's when they also take on more nutrients. When we have high toxicity, let's say you have high cadmium or high mercury poisoning, then your body tries to flush out that mercury. And to flush out mercury, it needs iodine, selenium, molybdenum, then potassium is, for example, it's a block. I don't explain that now, but then here phosphorus. So you have a flushing out of toxins requires huge amounts of minerals. Your body tries with those minerals to flush out the toxins, so you go into a deficit, and that's why they are so low. As soon as you now flush out the toxins and you bind them, your body can absorb those minerals and nutrients back into the cell. And that's why supplementation or IV treatments work miracles after PMF. It's like the cell is open to take on the nutrients. So when you go to a good clinic, and you know, in some clinics they use IV cocktails. They do your tests, they know exactly what is low, what needs to be corrected. They get you the panel, and then they fill sodium bicarbonate bag with sodium bicarbonate, and then they inject all the different minerals and vitamins and whatever you're low into that cocktail. So it's for you the ideal solution. Then they put you onto PMF and they stimulate all your absorption into all the organs that you need. And then they sit you onto the chair with your drip. And the absorption rate is hugely increased. So it has an effect. If you take supplements, where do most of your supplements end up? In the toilet, right? They just get pooed out. So by using your PMF machine before and after, or morning and evening when you take your supplements, and you pulse your gut and you activate your digestive system, you open up all the cells, the nutrient uptake will be greatly increased. All right? And that is when we then see a retirement village having different problems. You know, I love that little story because it shows that there is, I know everything has a drawback and benefit. Before, everybody was really, old, pain, difficult, whatever, and then they bought those PMF machines and they started to use them regularly. They really trained people to do them, and they were catching up. And they were really lining up in the morning and afternoon to do their treatments. And the energy level was raising. And the nurse said, we have different problems now. We don't have aches and pains. We have libido problem coming back. We have dancing in the corridors. We have parties, late nights. They don't want to go to bed. So there is different issues to deal with now. But our patients feel a lot better. I think they have ordered now 6 devices in a row for all their different villages. And that's phenomenal to see. We have it in clinics. And the nice thing, and this is something I wanted to tell you too, we're so close to FDA approval. Michael has already the paperwork. If it goes through within the next few weeks, we have FDA approval for all the digital devices. And that is a dream come true, because then it can be legally used in clinics and by doctors. And we're really just waiting for it. So if you buy a device, it will automatically be included in that FDA approval once it is through. And that will give you a legal advantage to use it for pain, to use it for wound healing. And there is, I think, 5 or 6 applications where it's approved, not for cancer, because we will never get it through for cancer, but for those basic factors like for detoxification, wound healing, expedited wound healing, for osteoporosis, for pain management. And that's all we need to be on the legal side. And then we use it for everything that we need it for, right? Animals love it too. Horses, really intense. And I have to tell you very short, my experience, I went to a horse stable, and I never trust horses. They're too much right brain, they're too nervous, too jittery. And I was riding for a while, I fell off a few times, my horse was completely nuts. Or it was me and the horse didn't like me, but it was like, I was cautious. So I stood there with my PMF, and when you feel that thing, it really goes bang, bang. So I was like very careful. And then the horse was leaning in and lifted up shoulder and rolled around and lifted up leg. It was pressing me more and more against the wall. And I was standing wall behind and, holding the horse away with the PMF. It was phenomenal. They love it and they respond. Like I said, if a horse runs and they have a gait, like they move sideways instead of straight, they trade the other side and they bring the horse back into alignment. the sacral. All racehorses are treated with PMF before the race, after a race, their tendons, their feet, their shoulders, everything to get top performance. And that now jumps into all the high athlete sport. Tennis elbows, tennis arms, soccer, when they kick sideways, you know, all the tendons get damaged. And they treat that on the spot with those devices. There is a power supply for this device if you want one. And so that it's mobile for the soccer field. Normal people don't use that. But it is really great. They prevent people from going on to 3, 4, 5 days out because of injury to go back into the game within minutes. So it is very valuable and very effective. And that brings me to my last section, where I really want to talk about that immune stimulation we've covered. There is many different immune cells, and all of them are fully activated. You've seen my movie probably 100 times. This is really the effect that you get. They move faster, they move more effective. I don't know if that movie starts. No, it doesn't. So it's just an image. Oh no, it does, look. See, this one moves too, that's an image too. You see them? How they move, how they squeeze through the blood cells. Same thing here. As they move through those blood cells and they squeeze through, they chase bacteria and clean up, and then that's where they need 100 times more oxygen. If I supply that and I give that to the body and my immune system works, that takes care of everything. See, none of the chemicals can treat, for example, chemo-resistant cancer cells. But your immune system can. So priming your immune system, instead of killing it with antibiotics, killing it with chemotherapy, stimulating your immune system to the maximum performance, getting rid of the toxins, getting rid of all the dirt and gunk and everything, giving enough oxygen to your system, and half the battle is won. You cannot go backwards. You always move forward towards health. And that's why we're so excited about this treatment. PMF and inflammation. You know, when you have an inflamed area, like here, a splinter, it gets red and it gets hot. That's a local fever. That's where your blood circulation is increased. Now, if you use, and that's what those sports people do when they have injuries, when they use that like this, and the injury would be here in the middle, or you have an injury on your shoulder and you have that treatment there, it will activate that healing process like we found in those studies by factor 4. That's huge. So you do it with oscillating as well, just slower. Heavy metal detox, deficiencies, stress, trauma, parasites, bacteria, virus, all of that causes inflammation. So if we stimulate our immune system, that will take down every inflammation and help with the healing process. PMF and cancer, same thing. You know, we don't treat the cancer, we treat the system. We clean the fish tank so that the fish can swim healthy in the tank. We don't treat the fish. So again, by using that extreme oxygenation, nutrient uptake, cleansing, detoxification, enhanced by PMF, we reduce the cancer load and we heal the cancer. Killing individual cancer cells, like targeted, really smashing them with PMF, is something that works very limited. And I wouldn't focus on that. Don't think you need to smash that cancer. It can have the adverse reaction. Your cancers are laden with heavy metals. They are laden with toxins. They have, 40,000 times higher concentration of toxins than healthy tissue. So by smashing your cancer cells to death, you release massive amounts of toxins. Rather, make your environment so that it can be taken out, that it can be transported out, that you detoxify really well. And then do gently, a little bit at a time, so that you bring the toxic load down, and then the body will discard those cancer cells as well. PMF and wound healing. Dr. Finn Scott Anderson was one of the pioneers. He did a lot of papers, a lot of research papers. Wound healing with PMF before and after mastectomy, before and after surgery. with or without PEMF, and the results were phenomenal. They had an ion counter. You get little devices that you can buy to measure the ion concentration, and the more you give ion shooter, negative ions, the more you give, the faster the healing process. And again, they expedited by factor 2 the healing process. You can see here some of his charts, how fast the healing process was done with PEMF in comparison to without. So if you have scar tissue, if you have wounds, PEMF in depression, what causes depression? Heavy metal toxicity, lack of oxygen, lack of ATP production, lack of energy, all of that together in combination with parasites and fungus and virus. All of that suppresses your immune system, knocks your system down. No ATP production causes no energy. So by changing that metabolic system, you will always increase your energy, you increase ATP, you increase oxygen uptake, you detoxify faster, and the result is better health. You realize it's always the same. Osteoporosis, hundreds of studies showing that PEMF will increase bone density. My mum had totally crippled hands from 100 breaks. You know, like every time she smashed her hand like that, the bone were broken. High osteoporosis. So what we did was we put her a PEMF machine in, and she was treating that every evening. Now she can do knitting and stitching and everything again. Her eyes now struggle a little bit, find things, but she can work with her hands like before, write and do, because everything became smooth and working again. She's using it for her legs, for her hips, for her sacral, all around. She wouldn't survive a day without that machine. It's like her life force. In the morning she sits on, in the afternoon she sits down, in the evening she takes it into her bed. She is addicted to that machine. Both of my parents and parents-in-law are really adamant they wouldn't survive. They travel with that device no matter where they go. And I know plenty more people. PEMF in sleep, there is plenty of research that it helps. I had one lady, she did everything under the sun. She was trying everything. She was to 20 doctors. She had every gadget, anything. I hope she's listening today. If you do, please send a short note. But yeah, she was using the PEMF, the digital, the big device, and was using that for about a week and a half. And her whole levels went down, and sleep apnea was gone, completely gone. So phenomenal results. Degenerative diseases in general, incontinence, very powerful. You know, the diaphragm from the belly pressing on the bladder, the muscles that close, also your closure muscles, really powerful. We use it for dogs, but we use it mostly for humans. Like I said, you can get rid of incontinence in a very short time. Just put that thing underneath, sit on it. You can even make a cushion. You know, some of the clinics, they really use the paddle directly, or they use this and have built a little cushion around so that you sit soft and otherwise uncomfortable. And you sit on here and you pulse into your diaphragm and into your, lower chakras and activate and energize. And within no time, and that's where it really comes together. Ozone insufflation, vaginal insufflation, and rectal insufflation, and then using PEMF at the same time, and you have extraordinary results. Again, what is it? Oxygen for ATP production, to energize, to heal, and to do the repair, especially with ozone, that repair energy of repair of tissue, and the energy given by PEMF, you have a tremendous combination. And that's it. What now? We don't need to go through that. Now we go through some of the questions and we talk about some of the treatments. How long have we been going? I have no clue. 1.5 hours. Oh. How does PEMF work? What conditions is it used for? We've covered that. Understood correctly. Is it immune boosting? Could you explain how that works? Why would you use a butterfly adapter? What about PEMF for rheumatoid arthritis? Okay. Ta-da! how you use the device is actually one of those questions that I don't know how to answer, because it doesn't matter how you use it, it always works. What we try to do is get a systemic, see, where all organs live, a systemic treatment. So sitting on it as the first step would be really crucial, because that's how you treat all your prostate, ovarian, vaginal, rectal, all of that area. You pulse up and into the diaphragm of your bladder infections. Everything is treated with that. So that's very powerful. And then you put it into the back, like I said, kidneys and adrenals. Low power, doesn't need a lot. You don't need to smash your adrenals. Don't stress them. They have enough stress otherwise. Just gently pulse into that to support your liver detox, kidney detox, and to strengthen your sacral. It can be quite painful sometimes on your sacral area. It can be a piercing pain. Turn it down until you can bear it. Don't stretch too much. That's inflammation in that joint. And then slowly go up into, you can do it between your shoulders, just like that, and treat that. Again, pacemaker, be careful if you do that, that's too close. Then put it around your neck, to lung, thyroid and everything, and then put it on your belly. And males, swivel it up like that and put it on your genitals. And pulse directly from the top into the prostate. First you did from below, and now you do from above. Ovarian cancer, everything, same. So you pulse into that area. Now that would cover a systemic treatment. Your hands, because you hold it, are already in the field. Your arms are in the field. That's it. That would be once a day, more than sufficient. You get a full systemic treatment. That's it, right? Done? Finished? If you use the pad, you don't need to move it around. You can just lean against that in a chair and go like that, and then it goes back, back, back through the whole body. Plenty of power to do that with all of the devices, including the little DCM. Let me just grab it very short that you can see it. Here it is. I'm fully equipped right now. I should make a showroom. A little DCM, 3000 Gauss. I don't say 3500 anymore, because not even with the paddle, it comes in all measurements to about 3000 Gauss, but we won't change the name. And this is, as home device, a dream. This is something you can use all the time, and it really works. It's gentle, can be used by the whole family, by elderly people, by children, and it is very, very powerful because it still has that bang, it has that pulse. It is a dream device. And if you use that with the pad for the whole body, phenomenal treatment. Okay? Now, let me go to the other applicators and put that here. The other applicators are mostly used for joints. Instead of boxing from different sides, you can use that over your shoulders. You can use it for a tennis elbow. You can use it for your hand if you have injuries to your hand, for your wrist if you have problems there. And there is a little strap that comes with it, elastic strap. You put that around so that it holds here. You can use that like this, very intense, for neck problems if you have shoulder problems, from looking down to your mobile phone the whole day. And then when you try to see the sky, everything hurts. A lot of people have that disease of looking down. So if you put it here, it will release your shoulder tension, everything. You can also use it like this, over your shoulder directly. And the nice thing is, it allows you to be still free. Look at your mobile phone, and it covers that area. You can also use it for brain treatment. Very low setting, very gentle. Turn it all the way down, and then treat your brain. You can do that like this, but you can also do it like this. You just move it around and treat certain areas. They do that with children with autism, with problems with ALS, because at a certain pulse rate, you will see that pathogens are flagged or dying off. So if you have bacteria gotten into the brain, you have toxicity, to release that, it really is very beautiful. And when you look at those brain scanners, they put those flasks on to see which areas fire up and which ones are activated. It actually activates the whole brain really well. No, I don't want to talk to anybody now. Stop that. And so that's very, very effective. Like I said, you can do it like this, or you can do it with the butterfly. The butterfly is about double the power as the big loop. So if you want to intensify in a certain area, for example, liver detox, targeted liver detox, you would use the butterfly because it just has a lot more pulse and deep penetration because it's smaller. And like I said before, you can use the paddle because the paddle will give you the same thing. Very, very piercing, very narrow beam, probably rather to be used for bone cancer wherever you have it, and for areas that you really need to penetrate, like for example prostate or incontinence. We always use this or this because this is a little bit painful. It's not very pleasant. And like I said, overall, I would use most of the time. We use in the evening, we don't even bother about those things. We use the big pad. Like Gladys did in the movie, you can always use it. You put your leg through the big loop, and it's now behind the table, but you put your leg through and then pull it all the way up. And this way you have your treatment for the whole lower body part from both angles. And you can move around while you do the treatment, or when you have a shoulder treatment, a very nice way to do it is put your shoulder through like this, and then roll your shoulder while you have the treatment. You will find at certain spaces, certain movements that it really hurts, and then go into that area and turn it slowly down or up, what you like, and just feel that area, how it hurts. You can't do anything wrong. There's no right or wrong. You just don't overdo it. Gently, gently more, and the healing factor will come in a very, very short time. Done? Done? What about, I think we have to cut it anyway, it's too short. There's a few more questions, but we've covered them all. In regards to price, you'll find them on the website. We've updated them all. My slides are old, I don't show that anymore. We have specials now and then. We've added now with all our treatments the pad, the Mac pad, to the bundle because it just makes it so much more convenient to have that pad. So we've added it and we reduced our price a little bit so that you can afford it, because this really makes it a very easy treatment for the whole family without you juggling around and explaining it all. Just let somebody sit on this and that's it. Or let them lean against the chair and they have plenty of treatment which stimulates the immune system on an ongoing basis. All right? And that's it. Thank you for your patience to stay with me. Thank you for your passion for my passion. It's really fun. And I enjoy, we have our big antenna back on the roof. It's actually now 7 meters high so that we get fast internet. And I hope the reception was good and you could see it all and hear it all well. And yeah, let's look forward to many more webinars where we can explain and answer your questions and share the whole philosophy of healing or truly heal. Bye-bye.